Hello friend, welcome to my channel 5 Minute Pediatric. Today I will be discussing about atrial septum defect. So it is abnormal connection between the two arteria. Okay. Now it is of two types. Ostium secundum, most common. It is generally located at fossa ovalis. Second is ostium primum, what we call endocardial Cushing defect, and this is associated with Down syndrome. Now ASD is more common in female than male. So some syndrome you have to remember. So first of all, Holt-Oram syndrome, Down syndrome, Ellis-Van-Crevald syndrome, thrombocytopenia associated radius syndrome, what we call TAR syndrome. So these are some syndrome that commonly associated with ASD. Now let's discuss the important aspect, what we call hemodynamics of ASD. So ASD, there is an abnormal connection between left atrium and right atrium. Blood flow from left to right because the pressure of left atrium is slightly higher than right side. So here we have left to right shunt. Because the pressure difference is so minor that you cannot appreciate the murmur. So there is no shunt murmur. Now there is volume overload in the right atrium leading to right atrial dilatation and hypertrophy. Now during diastole, large amount of blood passes from right atrium to right ventricle through the tricuspid valve. So there is a delayed diastolic murmur and accentuation of first heart sound. Now the volume overload to the right ventricle, this lead to right ventricle hypertrophy and paraesternal heave. Now large blood is passes through this pulmonary valve, so there is pulmonary ejection systolic murmur. When the blood is passed through pulmonary valve, there is a delayed closure of pulmonary valve, so there is P2 is delayed and accentuated, and there is wide split and fixed S2. This is specific of ASD. Now increased blood flow passes through the pulmonary circulation, so there is pulmonary plethora that causes pulmonary hypertension. So now the question is why the left atrium is not enlarged in case of ASD. So because the reason is because it decompresses itself by shunting blood to the right atrium at a minor difference in pressure. Yes, left atrium may be enlarged once it develops Eisenmenger syndrome, and in that condition there is reversal of shunt. So clinical feature of ASD are as follows. Usually the patient are asymptomatic. They might develop exercise intolerance, may have respiratory tract infection, but CHF is rare. And infective carditis is also rare in case of ASD. Complication usually develops in fourth decades and include pulmonary hypertension, strokes, right-sided hypertension, heart failure, and Eisenmenger syndrome. So if we go for the chest X-ray, you can find there is right atrial hypertension, right ventricular dilatation, right atrium dilatation. There is plethoric lung filled, but the size of the heart remains usually mild to moderate cardiomegaly is there. Okay, these are the important points that you have to remember regarding ASD. Hope so.